Mm-hmm. Mm-hmm.
Wow.
Want to need Mamta because capital M.
ಸೊ ನೀವು ಈಗ ವಿಕಾಸ್ ಅವ್ರ ಐಡಿಲೇ ಇದ್ ಮಾಡ್ತೀರಾ ಅಲ್ವಾ?
ಒಂದು ನಿಮಿಷ ಮಮ್ತುನ್ ಇದ್ರಲ್ಲಿ ಸ್ಕ್ರೀನ್ ಶೇರ್ ಮಾಡ್ತೀನಿ, ಒಂದು ನಿಮಿಷ ಇರಿ. ಪಾಸ್ವರ್ಡ್ ಅವತ್ತು ಕೊಟ್ಟನಲ್ಲ ನನಗೆ. ಎಲ್ಲಿದೆ? ಎಲ್ಲಿದೆ ತೋರಿಸೋದು?
ಎಲ್ಲಿ ಕಳಿಸಿದ್ರಿ ಅಂತ ಇಲ್ಲಿದ್ದಲ್ಲ.
ಮಮತಾ ಯೂಟ್ಯೂಬ್ ಕ್ಯಾಮ್ರಾ ಆಫ್ ಮಾಡಿರೋ ಸದ್ಯಕ್ಕೆ.
ಯೂಟ್ಯೂಬ್ ಕ್ಯಾಮ್ರಾ ಹೆಂಗೆ ಆಫ್ ಮಾಡೋದು? ಒಂದು ನಿಮಿಷ. ಅದು ಆಫ್ ಮಾಡೋಕ್ಕೆ ಆಗ್ತಿಲ್ವಲ್ಲ. ಕ್ಯಾಮ್ರಾ ಆಫ್ ಮಾಡೋಕ್ಕೆ ಆಗ್ತಿಲ್ಲ ಸದ್ಯಕ್ಕೆ. ಆಮೇಲೆ ಆಗ್ಬೇಕಿತ್ತು ನಾನು. ಎನಿ ಹೌ ಮೀಟಿಂಗ್ ಲಿಂಕು
ಮತ್ತೆ ಇದು ಏನು ಬರೀ ಮಮತಾ ಮಾತ್ರ ಕಾಣಿಸ್ಲಿ, ಇಬ್ರು ಕಾಣಿಸ್ತಿದ್ರ ಯೂಟ್ಯೂಬ್ ವಿಡಿಯೋದಲ್ಲಿ?
ಒಂದು ನಿಮಿಷ ನಾನು ಸೆಟ್ ಮಾಡಿ ಹೋಗ್ತಿದ್ದೀನಿ.
ಅದೇ ನೀವು ಲೈವ್ ಅಲ್ಲಿ ಇದ್ದೀರಾ ಅಲ್ಲ?
ಬೇರೆಯವ್ರು ಇದ್ದಾರಾ ಲೈವ್ ಅಲ್ಲಿ? ಬೇರೆ ಯಾರು ಇದ್ದಾರ ಅಥವಾ ನಾವು ಮಾತ್ರ ಇರೋದು ಲೈವ್ ಅಲ್ಲಿ?
ಲೈವ್ ಅಲ್ಲಿ ಎಲ್ಲರೂ ಇದ್ದಾರೆ. ಈಗ ನೀವೇನ್ ಮಾಡ್ತಿದ್ದೀರಿ ಎಲ್ಲ ಕೇಳಿಸ್ತಿದೆ.
ಎಷ್ಟು ಜನ ಇದ್ದಾರೆ ಲೈವ್ ಆಗಿ?
ಲೈವ್ ಅಲ್ಲಿ ನೋಡ್ತಿದ್ದೀನಿ. ಅದೇನ್ ತೊಂದ್ರೆ ಇಲ್ಲ, ಮಾಡಿ ಮಾಡಿ.
ಓಕೆ, ನಾನು ಸ್ಕ್ರೀನ್ ಶೇರ್ ಮಾಡ್ತೀನಿ ನಾನು ಇವಾಗಲೇ.
ಇರಿ ಒಂದು ನಿಮಿಷ. ಯಾರಿಂದ ಮಾಡ್ತಿದ್ದೀರಾ? ವಿಕಾಸಿಂದ ಮಾಡ್ತಿದ್ದೀರಾ?
ವಿಕಾಸಿಂದ.
ಓಕೆ, ಶೋರ್. ಮಮತಾನ ಪಿನ್ ಮಾಡ್ತೀನಿ. ಓಕೆನಾ? ಇದು ಪ್ರೆಸೆಂಟಿಂಗ್ ಈಗ್ಲೇ ಇದ್ ಮಾಡ್ಬೇಕಿತ್ತ ಯೂಟ್ಯೂಬ್ ದರ? ಇದು
ಅದೇ ಯೂಟ್ಯೂಬ್ ಲೈವ್ ಇವಾಗಲೇ ಪ್ರೆಸೆಂಟೇಷನ್ ಮಾಡ್ಬೇಕಿತ್ತು ಅಂತ.
ಓಕೆ, ಇಷ್ಟೇ ಸಾಕು, ಬಿಟ್ಬಿಡಿ. ನೆಕ್ಸ್ಟ್ ಅವಳು ಇದ್ ಮಾಡ್ಕೊಂತಾಳೆ.
Participants will wait for another 5 to 10 minutes and will start the session.
Hmm. Yeah.
Okay. Namaste everyone. Good evening. Greetings from Lila Academy and Ayurveda. Today we are here to discuss an important topic, PCOD. It is my honor to welcome our speaker, my close friend Mamta. She is not only a dear friend but also a highly skilled Ayurveda practitioner. Dr. Mamta graduated from Jesus Ayurveda Medical College and Hospital and has been practicing Ayurveda for the past 8 years in Berlin, Germany. She specializes in the Panchakarma, Nadi Pariksha, and holistic patient care. We are privileged to have her with us today to share her knowledge and insights. Let us welcome Dr. Mamta. Over to you. Doctor, please unmute, and you can start. You have been muted. Unmute and start.
Hello, hi Sahana. How are you? Can you hear me?
Yes, I can hear you. I'm good.
Yeah. Good evening, everyone. Welcome to the today's seminar on PCOD and Ayurveda treatment. I'm Dr. Mamta. Before diving into the PCOD, let me give my brief introduction. I'm Dr. Mamta Siddhagowda and I'm in Berlin, Germany. I did my BMS in JSS Ayurveda College, Mysore, and I have over 8 years of experience in Ayurveda field and 5 to 4 years of experience in Germany. And today we need to discuss about PCOD, that is polycystic ovarian disorder. Here is what we can cover today is understanding polycystic ovarian disease, principle and Ayurveda approach and diagnostic methods in Ayurveda and Ayurvedic treatments and some real case studies along with last we'll end up with some question and answer session. And I aware that most of the people who are attending the seminar is medicos. Like you might have some ideas regarding the PCOD and what it is and how it is caused and for whom it is most affected and all some of the little more things like what is PCOD, what if comes in your mind, what is PCOD, and you will get to know who and all it is most affected and what and all the causes and some you will be having some of the little bit idea and I can explain you in brief and what it is, how it is caused and what it makes and all. And let us know the definition of PCOD first. PCOD is a common hormonal condition where affecting the most reproductive women around the age of 12 to 14 years of age, and it happens when the ovary, which regulates the menstrual cycle and provides the hormone, which develop many cysts over the ovaries due to the imbalance hormone levels, and it might leads to the excessive male hormones, which might causes excessive hair growth or some skin and hair changes, irregular menstruation or irregular periods with painful periods or scanty bleedings, or at end it will be difficulty in conceive. In India, it is more affected while when compared to other neighboring countries, when compared to China or Sri Lanka or some other neighboring countries. We want to know why India women's are mostly affected with polycystic ovarian disorder, and we have to discuss about this later. And when it is not treated properly, it might end up into some risk factors, that is diabetes or cardiovascular system or obesity, which cannot be might feel very much difficult to treat them. What and all the cause for PCOD in not only in India and almost all over the world. It might these are the some of the examples I can set. But rather than this, also apart from this, you can also see there are many peoples with many causes, because in Ayurveda we won't say all the peoples are same and they will be having the same symptoms or same signs. No, it's not in Ayurveda. It's not like that, because every individual have their different prakriti, and each individual have their own way. Like they will be having some or the other condition which is not very much related to this, or for some other diseases also. What are the main causes is lifestyle disorder, like dietary habits are impaired while consuming high processed food, or lack of physical activities, or when it comes to the increasing sedentary lifestyle due to the urbanization or due to the work from home or due to the laziness. People might not be able to do their physical activities for some or the other reason. And genetic and ethnic factor, that is due to the hereditary. The people might also say, yeah, I have the family history of PCOD. My mother was suffering from PCOD, or my sister was suffering from PCOD. So they will be having a lack of knowledge, and it might be also the due to the genetic, but it not shows like every time. It is only about a 6 to 10% genetically inherited PCOD. And due to the high stress level, people might end up with irritability in mind or lack of sleep that causes insomnia, and these are due to some stress reason and lack of awareness and late diagnosis. The people might not have some of the ideas during uh, their daily life, because what they have affected, they will be in bit of their struggling for their daily life in one or the other reason, but they are not aware of PCOD symptom. This might be the symptom of PCOD, or this is the reason why I'm getting the late periods, or they will think for some or the other reason they will be having problems. This is due to the lack of awareness and a lack of diagnosis. And at the end, it is with the environmental factor, that is due to the pollution and exposure to the endocrine disrupts affecting hormones. Um, when we come to the symptoms of PCOD, these are the some of the gist of symptoms. Uh, and there might be some other symptoms also, but the main symptoms which can also say this is really due to the PCOD, in that menstrual irregularities, reproductive issue, hormone imbalance, psychological symptoms, and metabolic disorder. There'll be changes in skin and hair. When it comes to the symptoms of PCOD, menstrual irregularities, that is, you can see there will be a irregular in periods. They might miss the periods for a couple of months, or like if they have their periods at the day one, they might be having scanty bleeding and no bleeding, or it might start at after 3 or 4 days the bleeding. It or might be due to the heavy bleeding or during periods, and painful micturition, what we compare that as udavarta in Ayurveda. And second one is the reproductive issue, people around the reproductive age, about 20 to 35 or 40, they might feel that they will be having a difficulty in conceiving, or due to the, and it might causes the lack of ovulation. And when it comes to the hormonal imbalance system, mm, there will be excessive androgen level, leading to hirsutism or excessive hair growth or face on chest, and there will be more male pattern baldness and more harshness of voice, of course. These are the changes when there will be the hormonal changes when related to the male pattern. Uh, Next is metabolical disorder. Weight gain, especially around the abdomen, and people might feel that they are obese and not meeting their BMI perfectly, and insulin resistant, leading to the high blood pressure, or increase in risk to type 2 diabetes, high cholesterol, and blood pressure. And you might be knowing the people who is taking the allopathic medicine or some other system of medicine, they might also take metformin or for some other reason, because of the metabolic disorder. If it is not properly treated in this way, they might end up with diabetes or cardiovascular disease also. For this reason, they might take the supplements of insulin resistance. Psychological symptoms is like mood swings, anxiety, depression, apart from the luteal phase. Let us discuss the menstrual cycle further. Apart from the luteal phase, when the woman is very much near to get her periods, she might feel irritability or mood swings. That is quite normal. Whereas in PCOD affected women, she will be having mood swings, anxiety, depression, and sleep disturbance or insomnia, because she will be having very much regular this kind of signs or symptoms. And when it comes to the skin and hair changes, acne, dark spots, patches on the neck, armpit, or irritability in the scalp, that is due to the dandruff or something. Before going into the risk factor or actually knowing what is PCOD, let us know what is actual normal thing happens in the woman. That is menstrual cycle. It is a cycle of 1 to 30 days, where she get her periods in the first day, and whatever happens during that cycle till the end of her phase or starting of our next cycle. That is menstrual cycle, that runs from 1 to 5 days. There will be shedding of what uterine lining, and due to the thickness of endometrium. When we come to the endometrium, we have to know what is the normal thickness of endometrium. That is 1 mm. When it exceeds from 12 to 15, that is quite abnormal. And yeah, only in 2 cases we can tell it is quite normal, only during the postpartum, and another one during the premenstrual syndrome. There will be more thickening of endometrium, so that is quite normal. And they, when they have their cycle again, it will come back to the normal thickness. So in menstrual phase, what happens is shedding of uterine lining, and leading to the menstrual bleeding. And our hormone level will be dropped, that is estrogen and progesterone will drop at this period. And then it overall L for next follicular phase. That the follicular phase will start from 6th day to day 13. And here the follicular stimulating hormone, the growth of follicles in the ovaries, and one follicle will mature and produce egg, and which will help for ovulation. And the next phase is ovulation, and it begins from the 14th day till uh, for the it exactly not start on the 14th day. It will run for 14 days in every alternative days or every day for another 10 days. And here, the luteinizing hormone causes the ovary to release the egg. When there will be a copulation or woman might be trying for the conceive, the egg, this is the fertile period for women. The egg travels down the fallopian tube where the fertilization can occur. And at the last stage, that is the luteal phase, and it will run till the next cycle occurs. Here, the ruptured follicles, excuse me, corpus luteum, which produce progesterone to maintain the uterine lining. If the fertilization doesn't occur, then the next cycle will happens. If the fertilization occurs, then the women start conceiving. That might say the people is end of PCOD. No, actually it is not. Then we can see what and all the risk factor which when the PCOD is untreated, it is not taken care or it is not diagnosed. Here you can see the uterus, where left hand side shows the very much quite normal ovaries, and in the right hand side it shows the PCOD, where in the ovaries it shows about the cyst. It might be a more cyst or one cyst. It differs. Like when we say the PCOD, it is obviously a polycystic. When it is uh, not treated proper way or taken the temporary treatment, it might end up into the endometrial cancer or cardiovascular disease, sleep apnea, obesity, infertility, or psychiatric or neurological disorder, or fatty liver. Yeah. Whereas these are the risk factor which has to be treated. Not only treating the PCOD causes, and also the woman will end up with these all conditions and leads to more miserable. And what and all the diagnostic unconventional treatment, what other sets of practice can afford. That is, diagnostic methods are usually a physical examination, blood test, and some ultrasonography, which can show the evidence of PCOD. And excuse me. And due to some are the taking medicines like hormonal pills, it doesn't only make the people to have more risk, but it also says it is not a complete treatment for them, where it only gives the treatment for to regulate the menstrual cycle. And if the menstrual cycle is on the regular basis, and this is like, yeah, it is treatment manner, but actually it is not. Only they'll be having some of the limitation, like the patient only can take the hormonal pills every time every month, like for our next periods. So this is not actually a good treatment, or I can say it is a better treatment at the moment, and it is not a permanent one. And let us see how we this Ayurveda will help in curing PCOD or managing the PCOD for the long term. Let us know what is Ayurveda first before going into the actual topic. So, how Ayurveda is correlated with PCOD. Very basic principle of Ayurveda is understanding the Prakriti. Like even each and individual have their own Prakriti. It is not same for one another. So next is the role of dosha. That is, in Ayurveda we have three bioenergies, that is Vata, Pitta, and Kapha. And these are very much helpful for knowing the person is healthy or unhealthy. If these energies are in imbalanced state, then the patient is called as a patient actually, and is unhealthy. And when the Vata, Pitta, and Kapha is in balanced state, is a healthy person. And balanced lifestyle importance. This will helps to know how diet and exercise, ahara, vihara, and all will be helpful for livelihood. Uh, Ayurvedic perspective on PCOD. In Ayurveda, PCOD is linked in the imbalance, that is with, as I said, Vata, Pitta, and Kapha, leading to the hormonal disturbance and ovarian dysfunction. What is the role of Kapha in PCOD? That will cause us the cyst formation, insulin resistance, and weight gain. And whereas in Pitta, it triggers the inflammation, acne, and excessive heat in the body. When it comes to the Vata, it disrupts the menstrual cycle and leading to the irregular periods and bloating. Nidana. I have simplified in such a way that it can be easily understood. Um, when it comes to the dietary or aharaja, excessive intake of heavily oily, sweet, and junk food or the processed food. What this makes actually, it aggravates the kapha. Excuse me. It aggravates the kapha and medas and lead to the metabolic imbalance. When it comes to the lifestyle or viharaja, sedentary lifestyle, lack of exercise, irregular sleep pattern. What happens with the vata, pitta, and kapha? It causes kapha and vata vitiation, leading to the hormonal disturbance. When it comes to the manasic, physiological, or psychological, stress, anxiety, depression, imbalance in vata and pitta affecting menstrual health. Agdimandya, weak digestion, that might lead to some metabolic disorder that is due to the poor digestion, and ama, toxins accumulation in the abdomen. Leads to the improper metabolism affecting the ovarian function. Bijadosti, that is genetically inherited or family history of PCOD. It is inherited due to the kapha and vata imbalance. When it comes to the samprapti, that is a pathogenesis of PCOD in Ayurveda, dosha prakopa, kapha pradhana tridosha dushti will occur, and that will aggravates the vata and pitta involvement. And kapha blocks the ovarian follicles here, and vata disturbs the ovulation, and pitta affect the metabolism. When with Agnimandya, digestive fire weakness, it is due to the impaired Jataragni and Datvagni. Leads to the ama, accumulation of ama toxins, and affects the reproductive health. Shroto Dushti, that is Artavavaha Shroto Dushti and Medovaha Shroto Dushti. This is how the follicles fails to mature and leads to the multiple cyst formation, where leads to the weight gain, insulin resistant, and hormonal imbalance. Dushya is rasa, uh, rakta, meda, or dushita here, and proper nutrition to the reproductive organ, leading to the menstrual irregularities. Manifestation of disease is irregular periods, cystic formation, infertility, weight gain, acne, and hirsutism, what we have already discussed. These are the classical symptoms of PCOD. But complication is already discussed as a risk factor which might lead to the infertility, diabetes, obesity, and cardiovascular issues. And when we come to the diagnosis method in Ayurveda for PCOD, we'll first start up with Trivida Pariksha, that is Darshan, Sparshan, and Prashna. In Darshan, we can see the physical signs like weight gain, acne, and excessive hair growth, or dark patches or around the neck, or bloating, or you can see the patient is obese. And with the Prashna, we can ask her about the menstrual regularities and infertility, stress, or diet, how is their dietary habits and lifestyle. Whereas in Sparshan, abdominal tenderness or detection of cyst formation in the ovaries, or medavriddhi, like fat accumulation. When it comes to the Ashtasthana Pariksha, like in Nadi Pariksha, we see the kapha vata imbalance, irregular or slow pulse indicating the metabolic sluggishness. And in Mutra Pariksha, frequent urination, possible sign of diabetes might be. And Mala Pariksha, constipation or irritable bowel syndrome, the patient will be often having constipation and diarrhea together. And Jihva Pariksha, there will be a thick white coating and reddish tongue. And there will be, because of accumulation of ama, you can also feel that is ama around the tongue. Shabda pariksha arsoness due to the kapha accumulation, and there will be due to the male hormones level is high. There will be some voice disturbance or male hormone, male voice also. Sparshan pariksha, oily skin, acne, excessive hair growth or dark patches. Indrik pariksha, dullness of eyes or dark circles around the face, or in akriti, you can see the patient is obese and distant of abdomen also. Diagnostic methods in Ayurveda, or in that will come to the systemic examination, that is Stanika Pariksha. We say there will Kapha Pradhana Dushti, obstruction of Artava Shrotas leading to the cyst formation. Vata Pradhana Dushti, irregular ovulation or scanty periods and abnormal uh, hormonal secretion. And Pitta Pradhana Dushti is excessive bleeding, acne, and emotional disturbance. When we come to the treatment, like Ayurveda line of treatment, there is a formula, as you all know. Like first, we'll do the Deepan Pachan, Anuloman, and Rasayan. This is the actually formula for not only for the PCOD, for all the diseases. Like whereas we can do the Deepan Pachan and Anuloman if digestive tract is all clear, it will be having a better absorption, and then we can introduce some Shamanoshadis. Or when we consider this is as a Shodhana, then we can actually start with a Shodhana Chikitsa. Shodhana Chikitsa is a Panchakarma therapy which helps in clear the blockages in Artavava Shrotas, regulates the ovarian function, and detoxify the body. Shamana Chikitsa is the herbal palliative treatment, that is we can take the medicine through orally. And Ahara Chikitsa is dietary recommendation, which is very much important, and Vihara Chikitsa is lifestyle recommendation. And Rasayana Chikitsa, we can give the Rasayana, it is a kind of immunity booster for them, should not affect with any other risk factors. When it comes to the Shodhana Chikitsa, it is of Vamana, Virechana, Basti, Nasya, and Raktamokshan. In Vamana, what is the purpose of doing Vamana is to remove the excess kapha and toxins and balance the hormones. It is the way how we can do is herbal introduction of vomiting with Yashti Madhu or Madanaphala. When we decide to give the Virechan, that is purgation therapy, that is due for the elimination of excessive pitta and detoxify the liver. Herbs like Trivrut and Avipatika churn can help them. When we decide to do the Basti, then it corrects the Vata imbalance and regulates the menstrual cycle. In this, very much required is Uttara Basti is most advisable with Dasamula Taila or Falagrita. Nasya, balancing the hormonal function by stimulating the hypothalamus, where in the pituitary gland most of the hormones are controlled. And this Nasya might also help in controlling the hormones by administrating the herbal soil like Shatavari Growth. Raktamokshan helps to purify the blood, and in turn helps in the reduce in the acne and insulin resistance by giving the leech therapy. Whereas in Shamana Chikitsa, first and foremost thing what we do is Agni Deepan and Amapachan. Whatever the inherited, whatever they have taken, Ama is causing the disease, it will helps in clearing the Ama. That is by Agni Mandya leading to the toxic accumulation. These herbs can be also used, that is Trikata Churna, Ingvashtak Churna, and the Guduchi. And there are some other more also. These are the only example I can set for you. And when it comes to the Vata and Kapha balancing herbs, you can go for Kanchanara Gugulu, Ashoka, Shatavari, Lodra, and Punarnava, Varuna, aloe vera, ashwagandha, because this will be having some lekana property in that, and it can help in reducing the kapha and balancing the kapha and vata. The hormone balancing and uterine tonics are like Shatapushpa, Eshtimadhu, and Bala and Eshtimadhu Taila. These are can be used for internal and external also. When it comes to the ahara chikitsa, like it is most and very much important. Like nowadays, the people are fond of doing diet. It is not actually a right method if you don't know how to do it in the right way. The grains like barley, ragi, quinoa. Quinoa is also a kind of millet. Millets are used. Vegetables like very bitter gourd, ash gourd, and drumstick, and spinach is mostly used. And fruits like pomegranate, apples, and berries. Like pomegranate has the property like it will reduce the fat accumulation in the abdomen, and it will also helps in the ama. And the protein like moong dal, almonds, flax seeds, and sunflower seeds can be used. And spices like turmeric, cinnamon, fenugreek, and black pepper, and healthy fat like cow's ghee, coconut oil, sesame oil, or avocado. These are the dietary gist I can explain you, but there are some other more also that will goes into your diet, which can really regulate your periods and make the hormonal balance. And mainly, we have to focus the foods which we have to be avoided rather by saying what you can take. You better avoid some of the food and take all the food, because each and every food gives its own vitamins and minerals which is very much required for one's good health. So it is better you can avoid some of the things. That is the good idea, we can say. That is the dietary product, refined sugar and sweets, cold and processed food, and soya products. If you avoid these things, and if you eat some other things which is very much helpful for you, that is the good idea for you. And vihara chikitsa, that is regular exercise, daily abhyanga, that is oil massage, stress management, and sleep regulation. When it comes to the yoga asana, baddha konasana, bhujangasana, and nadishoda pranayama, supta baddha konasana, and dhanurasana, these are the yoga asanas which can help in maintaining the imbalance in hormones and maintaining the good health. These forces will also help in uh, pelvic make the pelvic floor strong. You can also follow that. When it comes to the Ayurveda classical formulation, Rasayana Chikitsa, that is Shatavari Grut, Chawanprash, Guduchi, and Balashwagandha. These are the main you can take as a supplements. And formulation like Kanchanara Gugulu, Ashoka Arishta, Dashamula, Falagrit, Trifala, and Lohasava. These are the Ayurvedic formulation which can really help in the balancing the hormones and maintaining the good health with PCOD. And when it comes to the Charakas approach, of course, there will be a Shodan, Shaman, and Ahara Chikitsa. In Shodan, Vaman, Virechan, and Basti is most advisable. And woman will remove the excessive kapha and meda, and Virechan will remove the excessive pitta toxins and regulates the hormone. And the Basti, mainly the Uttara Basti, is suggested here to regulate the ovulation. When it comes to the Shaman Aushadhi, Agni Deepan and Amapachan is the most important. It is a formulation like formula for every disease. Like Trikata Churna, Ingvashtak Churna will helps to increase the Agni and digest the Ama. And Kapha Vata balancing herbs like Kanchanara Gugulu, Shatapushpa, or Fennel, Fenchel, Guduchi, and Ashwagandha also helpful in this case. Ashoka and Shatavari. Hormone balancing herbs like Punarnava and Kumari will regulate the menstrual cycle. When it comes to the Ahara Chikitsa, light warm food. Here also it is not much specified that you have to eat this thing, But if you know the gist, what is good for your health, that is the thing, that is the diet. And regular exercise, stress management. When it comes to the Shrutas approach of treatment, Shodhana and Shamana. In Shodhana, Rakta Mokshan and Udvartana is most advisable. Rakta Mokshana will help in excessive pitta condition like acne and insulin resistance. Udavarta, Udavartana will help in reduce the obesity and insulin resistance. That is a powder massage. Shamana Aushadhi is Granthik for cystic reduction. In this, the most commonly used is Gugudu because it has Lekana property and it can help in reducing the cyst. Not only in the ovary, it can also reduce the cyst wherever in the body and improves the ovarian function. Varuna, that because of Mutra line property, it will take out excessive accumulation of in toxins in the body and removes. Medohar, herbs like Guduchi also and Gugulu, Trifala regulates the fat metabolism, and Artava Vardak, that is Shatapushpa and Ashwagandha. This and Ashoka also will helps in Artava Vardak. Vagbata's approach. mm, It is mainly a panchakarma and rasayana and lifestyle management as of charaka. Here in Shodhana Chikitsa, it is mentioned Virechana and Basti is very much important. Virechana to remove the imbalanced hormones, excessive pitta, and Basti, it is mainly Uttara Basti is advisable here. And in Rasayana, you can suggest the Shatavari and Ashwagandha, Bala and Eshtimadu and Amalaki. And in lifestyle and yoga, pranayama, like which will regulates the vata and stress. And yoga, Baddha Konasana, Supta Baddha Konasana, Bhujangasana, as we discussed earlier. These are the yoga posture that will helps in maintaining the good health. When it comes to the summary of Ayurveda treatment and PCOD, yeah, like Ayurveda treatment for PCOD is the holistic and focus on detoxification of body balancing hormone and improves the metabolism, restoring reproductive health by combining the Shamana and Shodhana or by doing the Panchakarma therapies. Uh, like Ayurveda will provide a natural and long-term approach to manage the PCOD. When it comes to the real case studies, there are some example the women who were facing the problems with the PCOD and how they have overcome through that. This is the case study one, that the patient was complaining of irregular menstruation and weight gain. And patient profile was like she was 26 years old woman struggling with irregular menstrual cycle and weight gain and persist acne. In Ayurveda line of treatment, we diagnosed as a Vata and Kapha imbalance, which were leading to the ama and Agni Mandya because of she complained weight gain. And the treatment protocol was like we suggested her for the Virechan and Basti. Virechan removed her excessive toxins in the body, which reduced her pitta and removed her ama. And Basti, uh, by giving the decoction of herbs and detoxification of the body and regulate the metabolism. Herbal remedies like Kanchanara Gugulu to reduce the cyst formation and Ashoka and Shatavari for menstrual cycle regulation. And dietary life changes was also advisable to reduce the kapha and advised to take the warm, light, and easily digestible food like more of vegetables and fruits. And some of the yogas and walking therapies were suggested here to maintain the body weight. And after 4 months, her menstrual cycle was normalized, and she lost about 7 kg, and her acne was reduced significantly, and energy improved, and she felt overall healthier. And also, they continued the treatment for another 6 months, and now it is all okay with the menstruation cycle and her weight gain. And next case was like, the patient was of a reproductive age, and she wanted to conceive. And she was 30 years old woman expecting for the infertility due to the PCOD and irregular periods. It was failed. And in Ayurveda, we diagnosed with Vata and Kapha imbalance leading to the obstruction in Artava Shrotas and poor ovarian function affecting the ovulation. The treatment protocol was like a Panchakarma, Uttarabasti. We have advised, to remove the blockages in the Artava Shrotas, and herbal remedies like Falagrita, Trifala, and Ashwagandha to ensure the strength in the uterus. And diet and lifestyle changes like pranayama and some of the yoga postures, along with some daily physical activities, has been advised. And asked her to take low glycemic diet, which is very much easier for the digest. Most of them like fresh vegetables and whole grains and herbal teas. And outcome was like ovulation was restored within 3 months. The patient conceived naturally after 6 months of treatment. And this was one of the case. And case 3 was managed like symptoms without allopathy. The patient of 20 years old woman diagnosed with PCOD, experiencing excessive hair growth or obesity and cystic ovaries. Ayurveda diagnosis was like kapha and vata imbalance leading to the ama and agnimandya. The same old the patient was having the case study one. Patient was having similar problems like this, and the same line of treatment can be given. But in Ayurveda, it doesn't work like that. Each and individual is a different kind, and each and individual treatment is also differ like how their lifestyle or what is the symptoms and all. The same way here, the treatment protocol was herbal remedies, Trikata Churna and Ingvastak and Kanchanara to regulate their metabolism and increase their digestive capacity. And detoxification therapies like Virechana has been given, and dietary lifestyle modification also been done by suggesting the some of the yoga postures and regular physical activities. In this case, 50% of reduction of ovarian cyst within 5 months, and improved metabolism and reduced ascetism and increased energy level. And the patient is still on the treatment. Yeah, if they give the 100% of effort towards the treatment, if they are maintaining the daily dietary habits and lifestyle, and it might also help them to get better fastly. And in the case study 4, a patient aged about 25 years, woman struggling with a significant weight gain and insulin resistant with irregular cycles and persistent fatigue. Here, the Ayurveda diagnosis was like a predominant kapha and meda accumulation with Agni-mandya, and detoxification therapy like Virechana was suggested, and herbal intakes like Kanchanara, Gugula, and Trifala for the detoxification and improve the metabolism, and dietary lifestyle and yogasana were also advised to take kapha specifying diet and yoga posture like Supta Baddhasana and some of the postures which really help them to maintain the strong pelvic floor. And as at last, Rasayana is given, that is Shatavari and Amlaki, for their reproductive health and balance the blood sugar level. In this, outcome was within 6 months, the patient experienced reduction in weight by 9 kgs and improved in insulin sensitivity and the regulation of menstrual cycle, our energy level and overall well-being improved considerably. Case study 5. Mm, Here, the 32 years old woman with a long history of irregular cycle and secondary infertility. She had previously tried a conventional treatment with a limited success, where in Ayurveda we diagnosed as a imbalance in Vata and Kapha with obstruction of Arthava Shrotas and resulting in anovulation. Here also the treatment what we gave is for our ovulation. Uttarabasti was utilized to directly targeted to the reproductive system and clear the obstruction. And herbal formulation combination of Ashoka, Shatavari, and Varuna to regulate the menstrual cycle and improve the follicular health. And also advise some dietary and lifestyle uh, changes, that is reduction in stress by doing pranayama and some of the food intakes which really doesn't aggravate the kapha. The outcome was the treatment protocol restored ovulation cycle in 4 months. After 6 months of the treatment, the patient conceived naturally and highlighting the significant success in the fertilization restoration. Case study 6, that is 19-year-old adolescent experience early signs of PCOD such as acne, mild ascetism, and irregular menstruation, along with emotional stress. The Ayurveda diagnosed as early stage kapha imbalance combined with stress induced vata aggravating, leading to the onset of menstrual irregularities. The treatment was like administration of gentle formulation, including shatavari and hormonal balancing medicines, Triphala for the digestion or Ingvastaka Churna for digestion, and lifestyle modification. Here we haven't conducted any such Shodhana Chikitsa, while we wanted to try with some of how the medicines really act internally by taking, because with some of the restrictions. Um, and at last, we advised to take some Abhyanga and to reduce the uh, some of the toxins in the body. Uh, the outcome was after 3 to 4 months, the adolescent reported improved skin clarity and regulated menstrual cycle and reduction in the anxiety level. The early intervention helped to prevent the further progression of PCOD and symptoms. So, if it is diagnosed or if the women are aware earlier, these are the symptoms I'm facing, so I have to go and consult a doctor and take the lead or take some knowledge from them. That is the good idea. If they feel something it's changing their body or mental health, it is always advisable to reach the doctor as soon as possible to further treatment or to avoid the risk factors. Like case study summary, success of Ayurveda treatment for the PCOD. Uh, because in Ayurveda, it's always said the treatment will always differ from patient to patient and person to person. No matter, it is not just the protocol or something. If the patient come with certain symptoms having the same problems, and if 2% having the same symptoms, same problems, the treatment always be different, and we have to customize the panchakarma protocol for them. For that individual it's something different, and another individual is something different because of the prakriti. Ayurveda is mostly based on the prakriti. If the prakriti's analyzation is went well, then you have the idea how to treat the person. That is about that will grab about the 50% of treatment. Here we need to customize the panchakarma protocol, that is for the detoxification treatment like virechan, uttarabasti, and some of the cases for omana. If you know for which person we have to amplify the vamana, or for whom uttarabasti, or for whom Vamana, that will be very much helpful to treat the person or the patient or the woman. Um, if you know what to suggest according to their prakriti and according to the dosha vikruti, that will be a very good idea. You can be able to easily successful in the treatment. And herbal treatment, like we can target the herbal formulation, not only helps the reduction in cyst and also helps in balancing the hormone and strengthens the reproductive system and metabolism. Integrated lifestyle modification like diet, exercise, stress reduction, and long-term success. It will this lifestyle modification. It's bit uh, undigestible for the person who has to start very much new. And if it goes on day by day, it will be very much adjusted to them, and the lifestyle will automatically rescheduled. And the patient center of individual treatment protocol ensures that therapy is tailored to the patient's specific doshas and imbalance, leading to the highest success rate in restoration of reproductive health. Mm, like in statistically, how the Shodhan and Shamana Chikitsa, which can really help in the women for the PCOD to overcome. It has shown in Panchakarma therapies that showed about 80% of success rate, and herbal medicines contribute of 75%, and yoga dietary life changes is 85%. And if you go for the yoga and dietary lifestyle changes, and it is only required for the person or the woman or the patient to have the long-term treatment successful. And stress reduction method reflects about 70% success in the rate fall. When Ayurveda treatment is effectively manageable in the PCOD symptoms, whereas other system of medicine, it just gives the hormonal pill, and it is only for that month. If she take the hormonal pill for that month, and she will be having regular periods, and it doesn't pass on to the next month. If you want the treatment should be in a long term and useful method, it is better you can advise yourself with a no cost, that is with the dietary and yoga life changes. Multiple cases studies highlighted the significant health improvement. Integration of diet and lifestyle and herbal remedies is very much crucial. Mm, In conclusion, PCOD is manageable condition with the right approach. As I said, if you aware of the things what you have to do and what you have to change in your life, like lifestyle management or dietary, or if you want to go with unsurgical method of approach, or herbals and natural and bioproducts, that is very much good when you approach for the Ayurveda. That is manageable condition with the right approach. Ayurveda offers the holistic and natural way to restore the balance, improve the reproductive health, and enhance the overall well-being. A combination of panchakarma, herbal medicine, and dietary changes and lifestyle modification can significantly regulate hormonal imbalance and promote healing. Early diagnosis is the best way. If you find any of the changes in your daily routine, or if you find any discomfort in the body, it is best you can approach the doctor as soon as possible, as it is a journey to wellness starts with the self-love and proactive health choice. At last, your health is your greatest asset. You have to prioritize in it, and you have to invest on it. Take a look, and you have to give time for your health. Invest some of the ideas on your health. You have to maintain the healthy lifestyle. If you have any doubts regarding this PCOD, you can drop a text to the chat box, and my friend will help you to reach them. And it's very much thank you for you all for this session.
Yes. Thank you, Dr. Munita. In spite you're not well, thanks for giving us your precious time and sharing your valuable knowledge with us. And now let us see, we have got two doubts. Okay, line of treatment for patient having a Mrudu Costa on USG fatty liver grade 2 with a primary infertility.
Can you please repeat the question once again?
Yes. The patient having a Mrudu Costa,
Mm-hmm.
USG shows a fatty grade 2 fatty liver
Mm-hmm.
with a primary infertility.
Primary infertility. May I know the age of the patient or the person or the woman?
Yes, Arpita, you can unmute yourself and you can ask your doubt. Kusma Patil, Kshama Patil and Prerana. Yes, we'll clarify all your doubts one by one. Arpita, please unmute yourself and ask the doubt.
Patient is age of 32 years, around 28 to 30.
Okay. Mm-hmm. Here, mainly the PCOD, it's in your hand of treatment. Like if you're able to change the lifestyle modification, you can go through that. Or else, if you want any advice from the doctors or the experts, you can go for the specific treatments. That is, if you want from Ayurveda, it is better you can approach for the Uttarabasti. That will be very much helpful. And some of the Aushadis, what you can take. That will helps you to regain the energy in the uterus and helps in the ovulation. Apart from that, you can check with dietary and yoga. If you couldn't able to have time for to reach the doctors or the expert, this is the way. Or if you could able to reach the experts, that is a better thing. Like you also mentioned that you have the fatty liver, and this is mainly due to the mainly the problems due for the lifestyle management. So if you maintain the lifestyle thing on the certain dietary, if you start consuming the meal in Ayurveda, every time we say we have to take the meal in proper time. We have to take in the morning, afternoon, and night, and a certain period of time for the better absorption and digestion. If the absorption and digestion is very much proper, whatever you consume in your diet, it will be really helpful for you. So it is better you can consume about more leafy green leaf vegetables that will reduce the uh, fatty liver, because that has the metabolic property that which can really help for that. And certain here I couldn't able to tell you that you have to do this yoga position. Better I can suggest you that you can have a physical activities like going for a walk for 10 miles, or finishing the 10,000 steps every day. That might really help you in this. And for the if you want to conceive and make your fertility more, it is better you can approach the expert with diagnostics papers, that is with reports and all. That will be easily advisable, because blindly we can't tell this is the way you have to go, because we have to see the reports. That is the only way we can approach you.
Okay, the next question is different.
Yeah.
Yeah.
For the purpose of Rakta Mokshana, which vein we have to select?
For Rakta Mokshana, which vein to select? Our question is.
I'm getting some disturbance.
In Rakta Mokshana, which vein to select for Rakta Mokshana? Can you hear my voice? Yes, yes, doctor. Can you hear my voice now?
Hello. Is it
Can you hear my
audible?
voice? Yeah, it's audible for us.
Okay. Uh, can I hear it again? Is that possible?
Yes. For Rakta Mokshana, which vein to choose? Okay,
For
can you
Rakta
hear my?
Mokshana, I'm
Yeah.
not getting the full thing.
For Rakta Mokshana, which vein to be used or which vein to be chosen? Vein.
Can I
Okay.
get the question in a proper way because I'm not getting it in a.
Okay. Can I ask you another question? I'll just ask the. I'll repeat your
Can you
question.
drop it in the text box? That is very much clear for me. I can read.
Okay. The other question is difference of treatment in anovulatory and ovulatory cycle with PCOD. Dr. Anjali RK's question is difference of treatment in anovulatory and ovulatory cycle with PCOD.
In ovulatory, if the woman is fertile and she is having her ovulation phase properly, and it is usually it might take about 1 year for the fertility when they are trying to conceive. That is the thing here in ovulatory. But the thing is like they have to maintain their ovulation. They have to check their ovulation and start conceiving, like start copulating or mating. That will be easiest way. If it is an anovulatory, there we have to really suggest for some of the shamanaushadhi medicines which will helps the ovulation, and which will helps the quality of the egg. And at the day of 12 to 16 there will be a follicular test has been done. We can go through we can take the guidance of the follicular test. If the egg is released in the proper size and the proper time, then we'll suggest them to have, uh, uh, have the sex, and then it might the fertilization might occur, or it has to be repeated even now and then.
Okay. Is your doubt is clear, Dr. Anjali? Okay. The next question is from Pavitra.
Mhm,
The patient is lean without Meda and Kapha involvement.
mhm,
The patient have irregular bleeding
mhm,
twice in a month.
mhm.
Then what is the line of treatment?
Here, while saying the PCOD patient should always be obese, it is not right actually. The patient, it's not obese and lean. It might be due to the some hormonal imbalance also. If you go and treating the hormonal imbalance, then it might also reach for the treatment. The patient should not be obese for the PCOD. It is a wrong idea, a wrong thinking. The patient is having thin and good digestion power. It's also good, and we have to check it for hormonal therapies, like if hormone is secreting in the right way or not. We have to look into it and then give the treatment, or then suggest the treatment. There are many certain ways, like if the patient is not having their periods, there are innumerable ways to think. It is not only due to the obese or something. It might be due to the hormones, or it might be due to the hereditary, or it might be due to the irregular lifestyle or dietary habits. Yeah, these are.
Okay, I think your doubt is clear, Pavitra. Can we move to the next question? Okay, there is another question.
Mhm.
What is your view on PCOD? Since menarche and line of treatment, if the patient is about 24 years
Mhm.
and history of PCOD since 13 years
Mhm.
or since menarche.
um, uh, we have to see what age the patient really is here, and if the
24 years.
24 years, yeah.
Ah.
If the PCOD line of treatment depends on the two ways. If the patient is wanted to conceive, and we have to give the line of treatment in that way, or to maintain the healthy lifestyle, or to maintain the every regular menstruation. In these two ways, the treatment differs. If the patient want to have the healthy menstruation cycle, this is the way. Like we have to go with some detoxification of the body, and then introduce some of the herbal medicine and rasayan, and along with some Ayurvedic panchakarma procedures. And if the patient is wanted to get the treatment only for the infertility or to conceive, in case of PCOD, then we have to give the treatment in another way, which can help to increase the ovulation. In what way they are asking the question?
Like, could you like to specify any medicines to it?
Um, could you able to repeat the question once again?
Yes, the patient 24 years old having a PCOD since menarche.
Mhm.
Hmm.
And the patient wants to have a regular menstruation cycle for that need, or to patient want to conceive, for
Yeah,
which manner they are asking the treatment?
yeah. Can you clarify for both? For
Yeah.
the regular period also and
Mhm.
for the pregnancy. First, you
Okay.
can clarify for the regular
To
periods.
maintain the regular menstruation cycle, the patient
Hmm.
has, first and foremost thing is, like they have to change their lifestyle management and dietary habits. And the the second line of treatment is taking some of the herbal medicines, like which could really help for the menstruation. If they are having a very much heavy bleeding or something, ashoka or Ashoka or Kumari, that might help. If the patient is having very much scanty bleeding, or Pitta Vardaka Dravyas are advisable to take. If the patient is having irregular menstruation cycle, then the menstruation cycle should set in a proper way by advising panchakarma procedures. That is, with we have to see whether the pitta elevation is there, virechana, whether kapha elevation is there, vamana, or due to the vata it is obstructing some of the shrotas over there, that is the basti. We have to look into it. If the patient is wanted to conceive, since when she is having a menarche, she is having irregular periods, that might also consider it is due to the some genetic or hereditary factor here. If they want to if she want to conceive, then we have to check for the ovulation, when the ovulation occurs and when the follicular cells release. We have to see for that and then advise them.
Okay. Yes, your doubt is clear.
Mhm.
Okay. We have another question from Prerana.
Mhm.
Patient of age 20 years
Mhm.
complaining of excessive facial hair growth.
Mhm.
Yeah. And the patient is Pitta Prakriti.
Mhm.
Line of treatment for this.
Okay. It is mainly due to the imbalance hormone secretion. Here in Ayurveda, what it will do is like, the patient is also said that she is a Pitta Prakriti. It Shodhana Chikitsa is Virechana is most advisable. And for the hormonal imbalance, like Pushyanag Chur along with honey, or the rice water, it is very much advisable. So that will helps in the regulating the what hormonal imbalance, and maintaining the regular lifestyle and diet. Here we can't say that it is mainly due to the some of the reason. Hirsutism is due to the imbalance in the hormonal secretions will be like more testosterone and progesterone will be more in this case. That will lead to it. Yeah.
Okay. Would you like to suggest any external application for excessive facial hair?
As it is a hormonal imbalance, the hormone should be treated first. If I say there will be innumerable amount of oil or extractions in Ayurveda, which can I suggest, but it doesn't really cure on these things. And you can look after for the things which is having a Kshara property in it, and it will really helps in reducing that. And the Pitta Shamana is very much important in this case.
Yeah. Could you please specify, doctor, for any hair removal, facial hair removal treatment? Any combination would you like to tell to our dear students or the participants?
Yeah, that is best when it is taken. There is a combination of turmeric and gugulu. This is the very good combination where when you want to take it by yourself in your practice, that is a very good thing. Or you can check it for the curcuminoid. That is very much helpful for in this case.
Okay. Are we going to use the plain gogulu or any combination?
Plain gugulu is because as it is having a scraping property and reduce the kapha, that is better. It is a
Okay.
combination actually.
Okay. Rana, is your doubt is cleared?
Yes, ma'am. Thank you so much.
Okay. Acne, there is another question.
Mhm.
Acne reduction treatment for obese PCOD patient. The age of the patient is 25 years.
This is purely a metabolic disorder where the metabolic disorder needs to be changed in lifestyle. As I said, it is very much important. It is a rule. When you want to take the treatment like Shodhana Chikitsa, when it comes to the Panchakarma, you can take the Udavartana, Virechana, and Basti. These three will also helps in reducing the kapha accumulation in the body. And when it comes to the Shamana Aushadhi, like taking internal medicine, like Agni Deepan, which will increase the Agni in the body and removes the ama. Especially if the ama is removed and detoxification applies here, when you take the Anuloman more along with Deepan Pachan and Anuloman, this will help in the obesity. Yeah.
Yeah, any specific drugs for acne reduction?
Acne reduction. Here, specific drugs like Pitta Shamak drugs, we have to select it. That we can go with any up. If you want any application, that Kunkumadi Taila might be helpful. Like if you want to take any medicine for acne, that you can, I can really suggest, it is not directly for the acne, that you can take any Anuloman tablet that will be helpful, like Anuloman DS or Tricotachuna or Triphala or something. That will purify the blood and in turn reduce the acne. It is not, if we can't in Ayurveda, we won't give directly for the symptoms oriented. We will give the treatment for main root causes. Why acne is caused? Is there any disturbance between the blood cells or something, or is there any accumulation of toxins in the blood or in the medas dhatu? We check for it and then we'll suggest the medicine. It is not directly given for the acne. Acne might causes due to the hormonal imbalance also, and also due to the improper blood circulation. It is better way if you go for any purgative things. That is the good, right, and line of treatment for that. Yeah.
Okay, and there is again a sub question for a hair fall treatment. So, as the speaker said, if you correct the PCOD and if you correct the main cause for the PCOD, the hair fall and the acne, there will be a reduction.
Mhm.
Yes.
Can you repeat it again?
hair fall treatment.
Air
Treatment
fall.
for
Yeah, here when it comes to the air fall, it is mainly due to the pitta dosha, which is engaged and which has got destroyed. And here, when we come to the conclusion, when it is hormonal imbalance, there will be a set of symptoms which going to occur, like in hormonal imbalance, we see the air. We think the air should be on the head, scalp, but we can also witness the air on facial hairs, or hairs on the chest, or hairs on the back. Yeah, that is the abnormal thing. When we want to give the medicine to growth, air growth, that will go some different way actually, and we have to treat the root causes here. Again, it will come and fall into the same thing, and we have to reduce the pitta over here for the maintenance of good health, or to maintain the pitta dosha or doshita here, and we can go for virechan again. And then we can apply some of the oils, like if I want to tell the formulation, trichomor oil, that is very much good for the growth of hair, and it is easily available in all the Ayurveda pharmacy. And check for the things in the oil which has more amla in it, or brungaraja in it, or pitta reducing drugs in it. That is the good way. And if you want the formulation, trichomor oil is the best running in India, I can say, but I am not sure in back in India how much it is going to sell. Yeah.
Okay, doctor, there is another question for you.
Mhm.
Treatment for obese PCOD with a diabetes, 27 years old.
27 years old.
Huh.
Here, the patient is having may I know the stage of diabetes here? Type 2 diabetes it is? And since when long they are having the problem? Since when long they are having the problem, and diabetes also? Because after knowing the risk factors, I can easily tell the line of treatment.
2 years, type 2 diabetes.
Type 2 diabetes, 2 years.
Hmm.
Okay. Here, the line of treatment, it goes away from certain procedures, while I have said only about the Vamana, Virechan, and Basti and Rakta motion so far. But here we have to involve Shirodhar in it, because the patient is having the PCOD along with type 2 diabetes. The PCOD management will be as it's the same what we have to do, but diabetes, as it is a risk factor, we have to take again extra care on it. Like for the PCOD, the same line of treatment, we have to see what is wrong in that. Is it due to the metabolic problem, or due to the hormonal imbalance, or how it goes? And when it comes to the diabetic, we have to go for Shirodhara also here, because that is the only way it might help them to balance the insulin resistance in the body. That is what we can advise is takra arista, or takra with amla composition we can advise. When it goes as a line of treatment, and it is very much suggestible for virechana and shirodhara and basti, along with some of the oral medicines, like if the patient is having a disturbance in the bleeding, that is, they can take shatapushpa or shatavari, or kanchanara gugulu, they can take along with some of the medicines which can specify the diabetes, that is medodatu, medokshay. They can take the medicine which reduce the kapha in the body. And a dietary lifestyle and yoga, it is pretty much very important in their lifestyle because they have to burn their fat and reduce the obesity, and then it will be a good line of treatment for diabetes too.
Okay. There is another question. At 23 years old with a scanty bleeding,
Mm-hmm.
and she's having a PCOD
Mm-hmm.
with hyperlipidemia since 4 years.
Since 4 years. She's a 23 years.
Yeah, scanty bleeding with hyperlipidemia.
Okay. Here it is due to the hormonal imbalance, and there might be a obstruction in arthavasrotas, and this due to the vata involvement here. So, if there is a blockage of vata here, then it should be given the basti. It is not a uttara basti in this case because as the patient is too young, and it is quite, we have to think twice to advise the uttara basti because if she is not married too, and yeah, basti might help in this case, and it will because of the blockage of vata varna over the pelvic region, that might be the causes, and we have to check the causes. If that is the cause, then the basti might help in this case.
Okay. Marma point for Vidha Karma in PCOD. Nice question.
Yeah.
Marma point
Uh-huh.
for Vidha Karma in PCOD.
I'm very much sorry for this question to answer because I'm not very much expert in Marma Chikitsa. So that is entirely a gross subject for me, and yeah, we have to check it. And I'm sure that I can come back to you when you drop it in the message.
Okay, and the same for 24, the last question, the previous question which we have asked.
Mhm.
23 years old with hyperlipidemia. Can
Mhm.
you, they're asking for the oral medication in specific.
Okay. Here for the as she has suggested the scanty bleeding, right? Then the oral medications like it is good when she take the Kanchanar Gugulu, Shatapushpa, Shatavari, and Kumari. These are the things which might help them. If there is any formulation, check for the formulation having this content. That is the good thing.
Okay. There is another question. Patient having an absence of menstrual bleeding from 2 years.
Mm-hmm.
The age is 21
Mm-hmm.
and no history of diabetic and thyroid.
Okay. May I know the age of menarche?
Yes, Tarini. Can you please tell the age of the patient? 13. The age of the patient is 13.
Age of the patient is 13.
13.
May I clarify the age of the patient is 13?
Yes.
And
No. The age of the patient is 21. Age of
21.
menarche is 13.
Okay. In this case, it might be due to the hormonal imbalance which has obstructed the arthovasrotas over there, and it is the patient is obese or not?
Tarini, you can unmute yourself and you can ask the question. Obese. The patient is obese.
Patient is obese, yeah, because we have to note it that if why all of a sudden she is not having the periods, it might be due to the metabolic disorder. The main causes will be the metabolic disorder itself. there'll be disturbance in the metabolism, and this might indirectly affect on hormonal imbalance, and it will block the hormonal secretions that uh, which really helps in the menstruation cycle to occur. Yeah, as they have said, it is obese. They have to take the first line of treatment for the obesity and reduce the medodatu here, and take the Birechana. Lot of weight they have to reduce, and then they have to set a regular timing to get their hormones back to the normal level and get started with the periods. This might take about long days to get proper way, and hence they can try it, because there might be some of the other reason which is affecting this, but I think so it has already gone to the risk factor, and it might also need the first line of treatment and also the second line of treatment here.
Okay, so your doubt is clear, Tarini. Okay. Okay, there is another doubt. Does Raja Pravartini Vati works on PCOD?
Yeah, it really does work on PCOD, but unless and until why the cause is not noted, please don't take directly the Raja Pravartini, because it might be this for many reasons the PCOD can cause, and if there is any obstruction, your uterine lining is shedding on the proper time. If there is obstruction and the bleeding is not coming out, that is not a need. When you want to take the Raja Pravartini, it will even more increase the shedding of the blood in the uterine. So please know the cause, and then it is better to take the Raja Pravartini.
Okay.
PCOD is not only for not getting periods; it might be also due to the eye shedding level also.
Okay, there is another question. Any easy way to consume Kumari as a part of a daily routine?
As a part of daily routine.
Yes, Kumari.
Yeah, you can take Kumari along with milk or along with honey. That is the best thing. If you want to reduce the pitta in your body, it's better with, and if you want to reduce the